Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. Welcome, podcast number 8. I am very excited about this podcast. We are going to be talking about aging gracefully, and we have a super special guest with us today, Mary Rather.
Thank you.
Mary, how you doing?
I'm good.
Welcome.
Great. Thank you.
Welcome. So Mary she's got all these credentials,
Yes.
and she's an acute care adult and gerontology nurse practitioner. She has a master's in science, a bachelor of science in nursing, and a master's in nursing and board certified.
I am.
So
Yes.
she is here to talk to us about being healthy as you age, all the tips and strategies and secrets that she can share with us so that we can follow in her footsteps.
Mm-hmm.
Okay.
And I think you were telling me that you are at 2 to 3 long-term adult care.
2.5-ish. I take care of 2
2.5-ish.
all the way, and I pinch hit on Fridays at one in Fletcher. So.
What's that like, being at these acute long-term care adult facilities?
Nothing acute about it.
Nothing.
They're long-term care. I really, with the area I chose to follow was the gerontological part of my training. I started in an acute care facility in another part of the state, and with the emergency room and the acute care and the whole, practice type situation, quickly kind of found that my niche was more with the gerontology part. And so when I moved to Hendersonville, I was lucky enough to find a job working in the nursing homes and keeping our elders as healthy as possible, which is sometimes not so healthy, but, sometimes it is, fairly decent. Walking around on their walker is like, yay.
Mm-hmm. Yeah, baby steps, right?
Yeah.
Literally,
Yeah.
the
The
small
ones that are
things.
able to walk around with a cane or a walker are my victories. They're, out of the wheelchair and moving,
Yes.
all 4
Yeah.
appendages. You know what I mean?
We talk about movement a lot, so
Movement's
we
life.
totally understand that. So you've been a registered nurse for 20 plus years,
Yes.
from operating rooms to ICU units.
Mm-hmm.
So what brought you to the gerontology world?
I am, by definition, depending on which text you read, the next to the last, or the one just removed year of the baby boomers. So in that area, I will always have a job.
Got
Job
it.
security?
Yeah.
No, that helps, yeah.
And I think that at the age of 50 and above, people start paying, they listen. They're like, okay, I made it to 50 and never thought I'd get here, but now what do? Now I've got to worry about my cholesterol. I think I might be diabetic. My blood pressure is out of control. And, so they start listening more effectively because they have the conditions that will do a lot of damage.
Yeah.
I think that 50 years of age, that's when, as a child growing up, that you started to see your parents hit some health issues, some health concerns. You started to see some changes in your parents' medicine cabinet, where they're doing more statin medications, where they're worried about their blood pressure and cholesterol, or they might have taken more of an interest in their health at that point.
Yeah.
Because 50 is that plus or minus, maybe depending on who you talk to, that magic number of, I'm old. I'm getting older now.
Yeah.
Halfway. Halfway. Your mortality is smacking you in the face at that point.
Mm-hmm.
But why is it that we wait until we're there? You know what I mean?
I wish that America would focus more on being healthy at a younger age. I look to each generation. It's like, what did the I'm a baby boomer, so what did the millennials do different? What did the Y2K generation do different? What did the what's the next one out?
Generation X.
Yeah, Generation X. What are they doing better for health-wise? Because if America would just take a public service announcement that would say, simply, know your numbers. If each of us could be responsible for knowing our numbers of our blood pressure, our blood sugar, those two things alone would save more lives than...
and we could even take it to the next level.
I love that statement.
We just had a representative from a nutrition company that we use in this office, Standard Process, just come in for lunch, and she comes in every quarter. We're going to actually do a podcast with her. She's a wealth of knowledge and talks about the supplements and what they're good for, and we go into the chemistry a little bit, and she was telling us about this new product that they have. You do a blood spot test, and it actually can measure your fatty acid level in your body, in your, so, which is important for brain function, can prevent depression, can help with mental clarity. I mean, Alzheimer's. I mean, we're talking all this stuff. So not only know your numbers for blood pressure, blood sugar, cholesterol, but there's other numbers that can really, on a functional level, really steer you in a much better direction and keep you healthy and avoiding those things. So know your numbers can mean a lot. Yeah, that's powerful. It's a powerful statement there. Do you ever find or hear your patients say things like, I wish I would have done this. I wish... Do you hear? Because I'm curious.
Yeah. If I had known I was going to live this long, I would not have done fill in the blank.
Really?
I mean, I would not have drank so much. I would not have eaten this way. I would not be as big as I am for my bariatric patients. I would have, with people that have suffered a stroke, I would have paid more attention to my blood pressure. If I had known I was going to live this long, well, we don't get to know how long we're going to live, We
don't have that crystal ball.
I had a health scare at a younger age, so I started taking my health very seriously in my 30s.
What happened, if you don't mind?
I had thyroid cancer. And anytime you have the word cancer directed at you personally, it's like,
changes the definition.
Can't even imagine.
Exactly. And so having lived not an outrageously unhealthy life, a moderately healthy life, I really got the slap in the face wake up call of, now what do you do? Now what changes do you make? So
especially with the treatments that follow that diagnosis, that can really hinder your health progress in the future.
Yeah.
Couple of big operations, as we've discussed, that has affected my neck with the scar tissue and pulling my spine. So my alignment is challenged by my cancer. I am treating with the radioactive iodine, which was the treatment of the day. I have quadrupled my chances for leukemia, or doubled them twice. However you do that math, I did.
Yeah.
So I personally take a closer look, try to do better, try to eat better, fresh foods, lean meats, drink water, all those things that you hear about doing.
Yeah.
Be active, don't sit too much, I have a job where I round on my patients and then I sit in charts, so I use my Fitbit to move every hour, so I get up and I do 250 steps. It's not much, in the nice days, I can walk once around the building outside. When it's 12, not so much, but...
right.
I dare say that you have every single day go into your facilities and have this constant reminder right in your face every day of your own mortality or of your own reminders
what
to stay
could
healthy.
Happen if I don't take care of myself.
Your life.
Well, yeah. Hopefully I will not be a resident at one of my facilities or any other.
Yeah.
Hopefully. There are many people who are never a resident at a nursing home, However,
I think that number is getting proportionally unbalanced. Now more and more people are becoming residents with that. I think correct me if I'm wrong or if you see this a lot, but one of the things that we have a tendency to see, Dr. Nicole and I, are decreases in mobility from lack of exercise or whatever it is, sedentary desk job, that lead to these problems that have patients be in these long-term care facilities.
Mm-hmm.
I mean, obviously there's other things like heart attacks and strokes and things like that, but some of them are just inactivity.
Exactly. Like, for example,
Chronic disease related,
sitting related, lower spine related.
You see a lot of that.
Yeah.
Mm-hmm.
Yeah. Lower back pain.
Mm-hmm.
I wear my prescription pad out with treatment and pain medicine for chronic low back pain from, especially the people that are in a wheelchair. There's nowhere to go from there.
Yeah.
They're
sitting all day.
I have to treat the pain because there's no other way to relieve it. And yes, we have physical therapists, we have occupational therapists, we do therapy to the best of their personal ability.
But you're still limited.
But very limited.
Yeah.
Very limited.
I'll tell you, my grandma was always very healthy, always, ate her vegetables. She walked, 4 or 5 miles a day, did all this stuff. And she still had a stroke. She had a stroke walking up the stairs, and she ended up falling and having a head injury. Well, she was completely, paralyzed from that, basically. And so she went into the nursing home at about 120 pounds. Mm-hmm. 6 years later, she ended up passing away at gaining 65 to 70 pounds in the nursing home because her mobility is just so limited from there. Is that something that you see? Residents gaining weight?
We have a resident weight gain when they're healthy enough to want to eat.
Yeah.
But we kind of count on that because at end of life, when they stop eating, we kind of need that to keep them. Because often a family is not willing to let go, or the resident, actually hangs on to life for quite a while.
Yeah.
So we don't worry as much. I mean, we do address it, but not. I agree with you. It happens. Mm-hmm. Sometimes it's not a bad thing. Sometimes it goes too far, and it is a bad thing. So you just kind of have to take that on an individual person by person.
Yeah, I like that statement that you said that the residents hang on. Because that is also a reminder that as humans, as people, we are incredibly resilient.
We are.
We can come back from the brink.
Mm-hmm. I think we want to live. I think we want to move. It's our inner mammal, if you will, that wants to, go and be the hunter and gatherer, whichever, go and walk and run,
every cell of our body wants to, no matter how much we beat it down, no matter how much poison we put in our system, the negative thoughts, the sugar, the inactivity, our cells want to live. Mm-hmm. They want to be healthy.
Yes,
right?
they do.
Somehow they do. Thankfully, right?
I think that's one of the things that happens when you start. I found it to be true for me when I started eating better. I craved better.
Yes, that happens a lot.
And
that's such a good statement. When you start to eat better, you crave better.
You do.
Yes. And then you, for instance, the statement I made to the pharmaceutical rep just outside was, she asked me how I get my magnesium. I said I eat almonds every day, every single day. I have a serving of almonds in the morning for all the reasons, healthy reasons.
Absolutely. Healthy food there, almonds. So, so I see that you go to the gym regularly. I know you've told me this on many occasions. And you've done that for the vast majority of your life.
A lot of years.
So I know why, but why? Why do you, what benefit
Personally,
do you get?
I feel better. It helps me manage my weight. I've never had high blood pressure, but I have had high cholesterol, genetically high cholesterol. And I know that you've talked about the drug Lipitor, and I have to take it because I've tried not taking it, just the tiny 10 milligrams that I take. Mm-hmm. I have to take it, but the gym helps me manage my numbers, feel better, move better.
Yes.
I can do whatever I do at the gym, walk or do my HIIT routine or whatever I choose to do that day, and then stretch and, oh man, does stretching feel good.
Yes.
Don't you talking about your Drew Brees HIIT routine?
I did that once.
Okay.
Oh, and I think we need to mention your age because this is Aging Gracefully, and we're talking about that. So how old are you?
I am 55.
So you're 55. You have all these degrees. You're running 2 to 3 long-term care facilities as far as being the nurse practitioner in them. So that's a lot.
I train and do a half marathon speed walk about once a year.
That's awesome.
Okay, all right.
That's cool.
You should do 2 half marathons.
No,
that way you could do a full marathon. I'm trying to push you.
See what I'm working with here.
I know.
So that's great. So would you say that gym membership is part of your formula for aging gracefully?
It is for me.
Mm-hmm.
It is for me.
Mm-hmm.
Some people bike, and so you don't need a gym membership for that. Some people do other.
Yeah.
I think you run.
Yeah, I run and I go to the gym.
Okay,
Mm-hmm.
but some people are like, I don't want to be in a gym, and that's
right.
Whatever.
Absolutely.
Move.
Just
that's,
move. Mm-hmm.
Whatever movement you enjoy, do that.
Yes.
And I talk with my hands a lot.
Yes, I can relate. I'm Italian, so I get that. So what else would you say is part of the formula for aging gracefully?
I think for me personally, I enjoy coming here as a chiropractic patient. I think that spinal alignment and having your nerves touch all the parts that they can and communicate equally, and for me, makes a big difference.
That's awesome. I appreciate you saying that, because you're, coming from someone in Western medicine. Most of the time, Western medicine docs and nurses, they think that chiropractic is only good for back pain or neck pain. And although we do help with that and oftentimes can get rid of that, it's so much more than that.
I've discussed this with other Western medicine peers, and every time I say, I'm going to the chiropractor, one time I got a very, very, oh my God, you're going to why? You look fine. I'm like, exactly. I look fine and I feel good, and I'm going to a chiropractor so I can maintain that.
Yeah, right. So it's why you take that Lipitor medication.
It's part of.
What is that Thomas Edison quote? The doctor of the future will not prescribe medication. He will educate people and humans on diet and the health of the human frame. Something to that effect.
Yay.
And that was not a chiropractor. It's not a chiropractor saying that. It's somebody that from the outside that says, listen, if you don't eat well and care about your alignment and having every single nervous system tissue touching every cell 100% all the time, your body is going to have some kind of malfunction somewhere.
Mm-hmm. Feeding off that, I want to say another quote. It's, before you can heal somebody, you have to ask them if they're ready to give up what's making them sick.
True.
Right? So oftentimes it's intangible things that make us sick, stress related. How do you deal with stress? I mean, two full-time facilities.
Gym membership.
300 residents.
I run through whatever's bugging me.
Yeah.
And with the HIIT training, it works for me because for 1 minute I can run like the wind.
Nice.
And get it out. You know what
Love
I mean? And then
I
can recover for whatever routine I'm doing, 1 to 4 minutes.
Then you do the Rocky Shadow boxing.
And then
I can see you doing that.
That's awesome. How many days a week do you work out?
I go at least 3 days.
And you've done that for how many years?
Preferably more. Since I was 30-ish.
Okay.
20
over 25 years. Yeah. So that's great. So, and I see that you also, you practice what you preach, and that's part of your philosophy in life as well.
Yeah.
Professionally and personally as well. So,
I have not to digress too much, but the cardiovascular surgeon who weighs 300 pounds and his lab coat is busting at the buttons.
I love you, Mary. I love this conversation.
I'm going to take you seriously and stop eating my cheeseburgers. Right. You know what I mean?
Yeah.
If I come to you and, I'm looking the way with all due respect, persons of every size, okay?
Right.
I just try and present well, and I practice what I preach because I don't want to be hypocritical, if you will.
It's like a dentist with bad teeth.
I love that.
I can, say, yes, I have survived cancer. Yes, I have, and this is how I did it. Yes, I fought my high cholesterol. I know my numbers, and this is how I've done it, Yes, I have diabetes in my family, and I'm actually pre-diabetic, and this is how I fight it. And this is the diet I use.
Yes.
So
you are an amazing role model, and yes, you have a lot of information to share for healthcare, to help people in this community and beyond get healthy. And that's why we do this, so that we can share this with people that are suffering. They don't know what to do. They don't know the first step. And it's powerful stuff what you're saying right now.
Well, thank you. Thank you.
Do you find that you have a lot of you seem very passionate about this. You practice what you preach, you live it. So I can only imagine you bring that into your day-to-day business or work life at the facilities. Do you find that you can have a lot of resistance from residents?
Yes, absolutely.
Yeah.
Yes, the residents don't like to hear it a lot.
Mm-hmm.
However, the nurses that work with me listen. So
you're still affecting change.
That's great, because they need to hear it
listens who can make a change.
Yes.
And I've mentioned my pain management people. We discuss bringing the opioids down. We discuss alternative drugs to treat pain in different ways.
Yes.
So I don't have to prescribe so heavy doses of opioid medication.
Mm-hmm. We were talking about, you and me just a couple minutes ago, CBD oil. You're prescribing.
Brought that into the practice. I had to go through a lot of walls with the administration, educate at every level to, can we try this?
Great.
So just, trying to be the best person you can be given what you have.
Wow, you need to be in every nursing home and or packaging up your systems.
You need to take your show on the road.
Yeah, there you go. Yeah. There you go. Yeah, I don't know if you'll age so gracefully if you have 10 nursing homes under your...
I don't think I will.
Just saying. No, but I love that. The practice what you preach, we have it in our profession. We have chiropractors that do not work out, do not eat right, don't get adjusted, but yet they're...
started.
Yeah, so we get it, and we're big believers in that too.
And it's easy to take you both seriously because you practice what you preach.
Absolutely. Yeah, we make our spouses sick.
Yeah.
But yeah, it's part of it, and I think you don't get in this kind of profession, yours either, to not help people, and you can help more people if you live it.
Yeah. What in terms of helping people live it, what are some of the biggest roadblocks that you see on a day-to-day basis that maybe stop you, or you feel your hands are tied, or they're just difficult hurdles to overcome, helping patients get better, helping patients switch their mindset that I'm old and I'm going to die soon and there's nothing I can do about it?
Yeah, I have had more than one octogenarian or 70-year-old tell me, I have done this all my life, young lady, and I'm not stopping now. For example, we have smokers in both the buildings. Smoking is not good for you. Okay. I don't care what you say. I had one man who is in his 80s tell me, the smoking helped me get my lungs back. See, I'm better now. And he said it with absolute conviction. But, when you've done something, I guess, all your life.
Might have started when he was 10 or 12.
He is from the country and probably started in his teens. I don't know. He's got dementia now, so we'll never know when he started, but...
Yeah.
That's another big roadblock is I work with a good population of people with Alzheimer's and dementia.
Yes, which is
and the more they research prevalent. That, wow, is there any way to stop it? And please tell me what it is. I'll start right now.
Right, absolutely. Yeah, especially when we're talking about not having enough hands on deck in nursing homes.
Exactly.
And it's just there just isn't, and so there isn't a place for these people.
Right.
And who's going to take care of them?
The baby boomers that are
other blocks are just I've done it all my life. Finance is a big block. People sometimes are not able to afford to eat better.
Mm-hmm. Yeah. Yeah.
And so you kind of have to work with healthy choices and teach them how to read labels and understand sodium content, for example, and what that means. What does that mean to my blood pressure?
Yeah.
Right.
That's a whole other podcast conversation. Learning how to eat well on a budget. I mean, I've got student loans. I eat well on a budget.
Yeah.
But it is extremely hard. It is very, very hard, especially if a lot of your residents have mobility issues and they can't do it on their own.
Exactly.
So for the younger listeners that are listening to this podcast, specifically keeping aging gracefully in mind and living this busy life that we live, not having time, thinking we don't have time, right? But what advice would you give to them to be able to age gracefully? We talked about exercise. We talked about knowing your numbers. Is there anything else that you would suggest younger folks pay attention to now in order to age gracefully?
One of the things that I was told much younger is, first, don't drink your calories, and secondly, increase your water intake. It's worked for me for several reasons. That is when I cut my sodas out and or switched to diet, which helped the pre-diabetic thing, which thankfully I did long before I knew I had that, but then also helped me with the weight management, sugar content.
Mm-hmm.
Sugar is, you may as well be listed with alcohol, sugar, and drugs.
Mm-hmm. Mm-hmm. Totally.
Because people don't realize what sugar does to your body. And I think the younger people, I think they're already doing this. I might be wrong, but, just understanding as much about nutrition as you can and practicing it as much as you can.
Mm-hmm. Mm-hmm. Yeah, that's a good one.
Yeah,
and water, I mean, there's a really good book. Have you ever read Your Body Cries for Water?
I've not read
The
it.
author believes that, it's an old book, the author believes that almost every form of chronic disease comes from dehydration. And water, just consuming water and making sure that you're hydrated can help prevent a lot of problems in your body. So that's a good tip as well.
I like that. The other thing that you had talked about was skin protection.
Mm-hmm. Sunscreen.
Yeah.
I have very fair skin, and I sunburn easily. Pay attention to that. I just most recently treated a tiny place right there.
Mm-hmm.
With basal cell carcinoma.
So that's another. That's one of those things that we overlook, right?
Yeah.
It's like, I want to get a tan. I want to have nice bronze skin.
I've done it too.
Yeah.
Okay,
So you cut school and went on the garage of your house.
I did not.
And
when you told me
vegetable oil
that you used vegetable oil, I was like,
all day.
Listen, I carry around an umbrella with me and like a dark black towel to put around my shoulders because if you say the word sun, it's red.
Okay.
Instantly.
So,
I know how you feel.
So that's great. So I love these tips for aging gracefully. I also have here in your bio that you live by this theory. You have a strong belief that anything is possible.
Yes.
Tell me about that.
Okay, Mary, you have cancer. I'm going to live through it. Okay, Mary, you're pre-diabetic. Well, I'm not going to get it. Okay, I'm going to learn how I can get through life without it. And I may eventually get it, but on that vein, with every effort that I have, I'm going to try to not be diabetic. And I'm making it thus far for 5 years. My A1C is under the mark now for 5 years. So whatever it is that you set your goal on, if it's a fitness goal, I want to run a marathon. Okay, then do that, but don't do it in one day. You're going to have to run a mile, and then 2, and then 5, and 10, and then 15, and then 20, 26, is it 26?
26.2.
We'll just keep going up.
You can't just... I didn't get there on that diet on day 1. I read it, and I did one thing, and I eliminated refined sugar from our house, okay? And then I worked on labels. I eliminated high fructose corn syrup from our house. More fresh fruits, more fresh vegetables, It just went in baby steps to the point of where we are now, which is largely fresh fruits, fresh foods and meats, and, beverages include, I drink coffee, but I drink it black. Research what it is you eat and drink it at its best quality. Black coffee is actually good for you.
Yeah, we're going to do a podcast on coffee. So this is great. So I just kind of made a little summary here of what your anything is possible theory is. So basically mind over matter. You have to believe it first. So if you believe that something is going to happen, if you believe you want something, you have to have that seed planted in your brain, and you have to keep positive thoughts surrounding that going all the time, and then you break it down into small action steps and make it happen.
Okay, yes.
Maybe we could take this show on the road for real. Anything is possible, Mary.
It is. Anything is possible.
Done.
So one of the things that we always do on a podcast, just to kind of go off on a little side note here, is we need to know what kind of socks you're wearing today, Dr. Brian.
I'm wearing my Christmas gift socks from Dr. Nicole, black and white. Little did she know that when she bought me black and red socks, that these are my two favorite colors to go together.
Okay.
I don't know why, but they are.
Because our hormones are in sync. That's awesome. Okay, so he's got his red and black check socks on today. Awesome. So in addition to that, on every podcast, we like to give our listeners one action step. You know, our podcast is called Balanced Life on the Go, and we're busy, you're busy. We want to give you practical information. I think there were a lot of pearls of wisdom, practical pearls of wisdom that was dropped on this podcast today. But we want to give you one action step that you can take today in regards to aging gracefully in this busy world to try and keep your life balanced. So we want to ask our guest, Mary, what piece of advice, parting piece of advice do you want to give our listeners?
One step. One baby step.
Can you only make it one baby step? Okay.
Replace one of your daily beverages with water. And if you're one of those crazy people that thinks, oh, I hate water, there's now 50 flavors on the shelf to make it the flavor of your choice.
Yeah.
With minimal impact to your diet and calories. So replace one beverage, just one, with water. One
You
day.
mean just one serving? Or you mean
like for
one...
instance, if I drink 3 sodas a day, take out 1 soda, replace it with water.
I like it.
You know, if I have 5 cups of coffee, take one out, just one, and replace it with water.
Perfect. Love it. Yeah, and you don't have to use the flavored water. You can flavor it yourself. You can put lemon, squeeze a lemon in it, lime. You could do a cucumber. You could do fruit in there. You know, you could do natural flavoring. So
short and easy.
Yep.
That's it. I mean, it just takes that one baby step. One baby step with the left leg. Then the right leg comes along, and then you keep taking.
And then you get into rhythm, and then you can move, and then you can go to the gym and see Mary at the gym.
Then you can party at a Cher concert.
Yes, there you go.
Yeah, exactly. So, well, we thank you so much for coming today and sharing. You definitely have been aging gracefully from what we can see, and we appreciate you sharing all these gold nuggets with our listeners. You have so much information to give and share. You're an awesome role model for this topic and much more. So keep on doing what you're doing, and we appreciate it. Thank you.